And actually, if you can wiggle your toes for me. There it is. Good.
I felt it, yeah. It actually feels good.
You said the fall was about a month or two ago, right? And then you said you
April
fell,
22nd, yeah.
And you had fallen, was it on your left side, you said, right?
Yeah, it was so fast, but when I landed more, I felt a squish right here.
Uh-huh.
But when I went down, then I was down on this side.
And it was a hard surface, not a
cement floor.
A cement floor.
Marshall's floor, you know, they're whatever they are. Yeah.
Gotcha. Okay.
And then I hit my head.
Okay, gotcha.
But I was able to get up, and I sat there for a minute, and then they put ice on my head.
Right.
So I was able to sit up and move.
You weren't like disabled or
disabled
really, you were able to move around
Yeah.
and stuff like that.
I
Okay.
just felt that little squish.
Okay, and so then after that, you said that it started on the left, but now it's kind of lingering still on the right.
Right.
Okay.
Yeah.
Okay, and now when you talk about the pain, so you said it's not going down the leg at all, it's just kind of focused right onto that glute.
It's right here, and sometimes if I get right, it goes more down my glute muscle there, and maybe this here, but that's as far. I don't go all the way down my leg.
Okay, gotcha.
But I know if I'm rubbing my leg and working, the whole thing feels better.
And you've not had any pain in the groin at all?
No, none.
Okay, so it's just kind of focused right on the hip and onto the glute here.
Right.
Okay, gotcha. Okay, well, let's get you scanned. Let's get you checked out. We're going to see what's going on here. Chin down just a little bit. There you go. So like I said, each time you come in, we're going to get you scanned here so we know what's going on here. Yeah, so you weren't kidding about that upper neck and the shoulders here, the upper back. A little bit of stress right in there. And then right here. The one that we're going to be looking at is right over here. Yeah. So again, this is that right SI joint right over here.
Yeah.
That's the spot right there. So here's the upper joint.
And this lower one.
That middle one right there, right?
That's when, there.
That's the one.
Yeah, that's when you make my leg move.
Yes. So as a little reflex, your leg pops up. Okay. Here's T4, 3, 4, 5. Then he's showing us on those ones.
The 3 and the 4.
The 3 and the 4 is a little bit more. Okay. So your neck's a little bit tricky just because, again, you have that C2 and that C3. That thing's fused together. So here is C5, 4, 5, 4. How's that C5 right there?
That feels pretty good, actually. It's not.
Feels pretty good.
Yeah.
Good.
I don't have any pain when you're pushing on it.
Good. Yeah, right there is where it gets a little bit more restricted there.
Yeah, I can feel a little crunchy when you...
Right, okay, good. Yeah. Okay, so yeah, so that C5 doesn't want to budge very much there. That's your C5 right there. Okay, I'm going to bring it down just a little bit just to help you to relax a little bit more here. Now you're very familiar with the popping and the noise that comes with the adjustment, right?
Yeah.
Okay, so all I need you to do just to relax here, let that chin just relax and fall over to the side. There you go. And chin up a little bit. There you go. Good. Right there. And chin up a little bit more. No. Good. Let it go. And actually, if you can wiggle your toes for me. There it is. Good.
I felt it, yeah. It actually feels good.
We're going to be looking to see how things have shifted. So especially on your pelvis. So you're going to see that the glutes, one side is lower than the other and one side is higher. When that glute's lower on the right side, that's a sign that that pelvis, it's dropped down like this, okay?
Right.
When that pelvis drops, we're also going to be looking at the size of the glutes because sometimes one side's going to be flatter, one side's going to be a little bit more bulkier. And the right side is much flatter here. So that's usually a sign that when that pelvis rotates this way, it's going to give a flatter appearance. So this is really matching up with the x-rays there. So when that pelvis drops down and it rotates in, that's what we're seeing on the x-ray. So you have what's called a PIIN. So we're going to really try to focus on getting that pelvis to bring that out, okay? All right, so we're just going to contact right onto that joint. So again, it's a PIIN, so we're going to really try to bring that out just a little bit here. There you go. Right there. Perfect. A little piece. And let that leg just relax there. There you go. There it is. Okay, coming up. I want you marching in place for me. Let's get some movement in that joint because we got some movement in there. I want to see if I can get some of the swelling out of there.
That's my part of my therapy.
Is that, yeah? Just to get some of the movement in that joint?
Sitting on a squeeze ball. Squeeze ball, yeah.
Good.
Marching in place.
Good.
Well, that's softened
The joint there? Yeah. And how's that feeling?
It's feeling a little better. I don't feel as much in the glute, but I still hurt here.
And then come on back, walking on the tippy toes. Good, and relax. And let's have you turn and face that way one more time. And let's go and have you walk on your heels now if you can.
Just the...
Good, and come on back one more time on the heels. Good. Yeah, so there's some good strength. I want to have you just walk normal now. Walk normal. And then come on back. Okay. So now let's have a seat. Let's see how things should look. Let's see if I can get a little bit more on that, or if that's going to be where we're going to leave it at. Okay. So let's go and see here. And a lot of times when we start that process, we can start to see a bit of improvement, and sometimes it can just linger and focalize into a specific area.
Okay.
And so that's going to be something that we're going to make sure that we take a look at. Let's see here how this is doing. Good. Good. Okay. Let's take a look at that joint here. Good. Good. Yeah, that movement's a lot better too. When I push into that, is that pretty sore still?
I can feel it, now there it gets a little sore.
Okay.
When you're up higher it wasn't, but when you get still a little sore there.
Right in there.
Yeah,
Okay.
and then a little below that now.
Good. It's definitely
Not much.
a lot better. So, in terms of the spine, so what we did today, again, when that pelvis drops down and then it rotates in, we're going to get a lot of that swelling down below here, okay? So we're going to try to push that guy out and try to get movement in there. And so we got a good start. So what we're going to do is now I want you to start doing some walking, especially today. It's a good day. Go out, do some walking, maybe 15-20 minutes or so. That's going to help to pump out some of the inflammation out of that joint. So once we get movement in the joint, now we got to do some walking and get some of the swelling out of there.
Okay.
And then next time you come, we'll probably see you'll get a little more movement on that next time as well. But that's a good start for today.
Okay.
Now in terms of your spine, so we did your right SI joint, and then we did your C5 here. Okay.
The one right you showed, yeah.
That's the one where that degeneration, the wear and tear is starting to happen.
Can you see the arthritis they said that was in there? Is that?
Oh yeah, that's the C5 right there.
It's the C5. That's what I was
That's the
looking.
wear and tear.
That's what I could see when I did that.
And again, so you do
Yeah.
have that fusion at C2 and C3.
Right.
And that's actually one of the benefits of having those x-rays, is it really helps us to have clarity about what's actually going on in there. Because looking at you is like, we have no clue, right?
Yeah.
But in terms of the x-rays, it gives us the most specificity, so I know exactly where I'm at on your spine, okay?
Okay.
So C5 and then your right SI joint. So those are the two that we're going to be working on today. Those are the ones that we did.
Okay.
But those are probably going to be the ones that we're going to be working on for some time, just because those are your major issues. Okay. All right. So that's going to be it for today. And then when you come back in next time, we'll see if we can get a little more movement on that. But I think over a period of time, we should start seeing a big difference. Okay?
I hope so, yeah. I
Yeah.
think so, yeah.
I believe we will.
My neck, I could tell the difference, just that one pop.
Yeah. Yes. Yeah. So that moved really well. So then next time you come in, we'll see how things are doing, and then we'll go
Okay.
from there. Okay. a lot of times we always say if you don't use it, you lose it.
Yeah.
And so if you're not moving all the time, if you're not using your muscles, using your strength, then a lot of times these muscles will start to waste your bones and all that stuff. It
Because
doesn't.
till I was 65, I worked 4 times a week.
Really? Okay.
Monday and Wednesday was step aerobics, and Tuesday and Thursday were strength training.
Yeah. So
All
working out is
slow
awesome.
straight, yeah, it was easy stuff.
Yeah. All
And I had to
right.
go back to work.
Well, that.
But they have a Silver Sneakers, and they have another program. Thought about getting back into it
And
later on.
Later on, as things got to clear up, if you
Yeah,
feel comfortable.
I thought I would like to do that, just do some, because they do a lot of moderate because of the age.
Yeah,
So,
for sure. All right. Well, you're all set.
Okay,
We'll
I'm
see you
good.
next time. Okay.
okay.